hair loss can happen after bariatric surgery, though it's not permanent, and your hair will grow back. So why does this happen? And what can you do to achieve great weight loss results and still have great hair? So please watch this video till end, because at the end I'm going to give you some tips on how to prevent hair loss after bariatric surgery, because they are going to be really useful for you. So a lot of time I do get patients, they want to get bariatric surgery done, but they're scared about hair loss. So the hair loss associated with weight loss surgery is called telogen effluvium and has to do with the normal hair growth cycle. It usually starts abruptly and very seldom lasts longer than 6 months. So if you are losing hair within 6 months of bariatric surgery, that's normal, and I'll tell you in next few minutes why it is considered normal. So why does it happen? Why do you lose hair, and how long does your hair fall out after bariatric surgery? So research has shown that the physiological stress resulting from major surgery and from rapid weight loss can cause body to shift nutrients towards vital organs such as heart, brain, and away from things such as hair growth. Although hair is important to us, it is not to the body. Hence, as a result, the hair growth phase could temporarily stop, and the dormant state or the resting phase, some hair loss to occur. Most commonly occurring within 6 months after post-operative period. And when the hair starts to grow again, the old hair follicle is released and you lose hair. Sometimes the hair comes out before new hair grows. Now the next question which might come into your mind, why does it happen? To understand this, we have to understand the human hair growth cycle. Now human hair has 3 stages in a growth cycle. The growth phase is called anagen, and the 90% of hair follicles are in this phase at any given time, followed by catagen, which lasts for 1 to 2 weeks, wherein hair follicles detach from the blood supply, and the resting phase is called telogen. In this phase, which lasts about 1 to 6 months with an average of 3 months, and during this stage hair loss happens. About 5 to 15% of our hair is in the resting phase at any given time. The normal hair growth is around 1.25 centimeter or 0.5 inch per month, or about 15 centimeters or 6 inch per year. Will my hair grow back after bariatric surgery changes? The hair loss will decrease. The hair should grow back as normal as long as there are no nutrient deficiencies and you are consuming adequate proteins. Now talking of proteins, let's go back and let's discuss about what are the common reasons for hair loss after bariatric surgery. Obviously, once I said surgery or any acute illness or any trauma or a weight loss is one of the reasons. The other reasons are chronic disease such as liver disease or any chronic debilitating disease. Hormonal imbalance such as hypothyroidism, polycystic ovaries, crash dieting, which is one of the major cause of hair loss, low protein intake, anorexia, and chronic iron deficiency. Heavy metal toxicity, if you are taking some Ayurvedic medication which have heavy metals. Medications such as beta, excess vitamin A, and anticoagulants. So what we have here are a few things that may be affecting people with hair loss. It starts with surgery, very low calorie diet, and possibly low protein intake. Then you add any illness over the way, and underactive thyroid, iron deficiencies, or genetically predisposed, and you get hair loss of along the way. The underactive thyroid and iron deficiency are the most important factors. Other nutrients implicated in the hair loss include zinc, biotin, folate, vitamin B6, and essential fatty acids. If no deficiency of these nutrients exists, then they will likely to be of little use. Let's come to the hair loss preventing tips, the most important thing which you must be waiting for. Relax and don't worry. It's natural hair loss of 5 to 15% of your hair due to the stress of surgery and weight loss. It rarely lasts more than 6 months. It grows back. Visit your primary care doctor to be evaluated for any illness or non-nutritional reason for hair loss such as thyroid disease or other chronic disease. Now, protein and more protein. Our program of bariatric surgery emphasizes the need of protein from the initial appointment throughout the duration of the band. Protein is the building block of all cells, including the cells that make up your hair. Failing to meet our recommendations of 60 grams per day, minimum per day, could leave you without thinning as well as less satiety. Make sure you consume lean protein food at each and every meal. This includes skinless chicken, lean grilled or baked fish, low-fat string cheese and cottage cheese, Greek yogurt, beans, protein bars, chia seeds, and flakes. Vegetarian, it is important to pair different vegetarian protein options at each meal to supply all of the necessary amino acids. Examples include beans, peas, quinoa, seeds and soya. Specific multivitamins, adequate B, folate, zinc and biotin. Don't forget you have vitamin B12 and calcium citrate. Iron matters. Iron deficiency anemia is considered one of the major causes of hair loss in a normal individual. Obviously, post gastric bypass surgery, there are very high chances of you being anemic. Iron is a micronutrient most commonly related to hair loss. Ferritin levels are indicative of iron storage in the body, and low ferritin levels are commonly associated with hair loss. Ask your dietitian or doctor to check your ferritin level if you think yours may be low. Now, symptoms of iron deficiency anemia may include fatigue, pale skin, weakness, and inability to regulate body temperature. Iron-rich food includes red meat, egg yolks, dark leafy green vegetables, beans, peas, legumes, and iron-enriched cereals. Include a vitamin C rich food when you are eating food high in iron because it increases the iron absorption. Try zinc. If you have tried tip 1, 2 and 3, consider adding additional zinc to your diet. Zinc is an important factor for the growth and development of healthy hair. Be sure to speak with your dietitian and doctor before starting a zinc supplement. An excessive amount of zinc can cause side effects. And what are the food which are rich in zinc? Oysters, red meat and poultry provide the majority of zinc. The other nutrients associated with health include vitamin A, folate, B6 and essential fatty acids. Hair loss can also be caused by systemic disease such as thyroid or a polycystic ovarian syndrome, and can also be influenced by the genetics. So I have tried all the best way to explain why do you lose hair after bariatric surgery. So don't lose hopes, and for any further information you can always reach our bariatric surgery program at AIG Hospital. Our team